Hello, this is Athena Jezik, and today I'm going to focus on the low back. A lot of pain oftentimes comes in the low back from sitting too long or slouching, particularly slouching, because you get your back all out of whack. It's usually down in the lower L lumbar vertebrae and within the SI joint, which is between the hips and the sacrum, and then in L1, so it's L5, S1. That's usually where a lot of the pain will start to come. Sometimes it's a little bit higher, depending on how you're sitting. So if you do have some kind of disc issues that develop from that because of the positioning that you're sitting in, some of that can be remedied with the subtle anatomy work, which I am teaching in the course. But if you're just wanting to massage something out of it, a lot of times the muscles will also get kind of tight and hold in. So we're going to be addressing the muscles in that area today. So I'm going to get the oil going, and you don't need a whole lot of oil for the low back. And it's good to take it up about to the top of the lumbar, to L1, down to L5, and then S1. And sometimes it goes a little bit into the gluteals, into the hips, so we'll take it into there a little bit. Sometimes that low back pain can feel like the hips are grabbing and kind of pressing in. Then it's a little bit deeper issue where the hips might be a little more involved, but usually this is what we find is right through here. So what you want to do is just feel around for tension in the low back. Just by, just kind of vibrating a little bit as you go out and not using a whole lot of pressure. Just enough to, there's kind of some tightness right here. So we'll just work through that a little bit slower. And you feel it, if you have the hands to find it, if the hands are trained enough to find it, you'll feel it working itself out. Now it may look like I have a lot of pressure there, but I really don't. And then that works that out a little bit, so there is a little bit of issue there. Backs can also be, this part of the back can also be, have pain because of jobs that are lifting things. Even though we might lift with our legs, the back is still does get involved. And if you're out of alignment, and not in the proper alignment as you're picking things up or you're twisting while you're doing that, that could irritate it even more. So you just go on either side. Now we're feeling on the other side the same kind of way. There's a little bit here, so we'll just wait. Yeah, when lifting needs strong abdominal muscles to kind of counter that. And unfortunately, the abdominal muscles usually aren't that strong in most people. So we end up with a little more pain than maybe we need to have, but the body does follow the lines of least resistance. So if there's muscles that aren't as strong to support, unless we're very attentive to that, we're not going to, it's just going to pass us by. And if we're more attentive to it, then we can begin to try to activate the abdominal muscles as well to help lift. Just to support, if nothing else. So here I'm going here. And a lot of attention should be paid really at the L5S1. That really does give most people problems. And that's a little bit hard to find sometimes, but you will feel the hip. It's right along the hip, actually. It's just a little bit above the hip. Moving it back and forth to get these muscles really relaxed through here. This can bring a lot of discomfort on. And then if you injure, like say you have a knee issue or something and you have to limp for a while, that's going to throw this back off because you're in a different position to walk instead of straight. You're limping, leaning to the side to protect that knee. Then that's going to create a misalignment down in this area, and that can start going into the hip. So you want to always look at what you're doing and start to kind of diagnose yourself as to why it might be in pain. The body is very capable of fixing itself if you can figure out what it needs. All you have to do sometimes is just give it a little help, and a lot of times it's not as serious as one thinks, but sometimes there's a little arthritis going on. Discs can be moved back into place with subtle anatomy work. It takes a bit of work to do that, but they can, and I've seen it happen. I've experienced doing it for people. It's all in the alignment process. If your sacrum is well aligned and the fulcrum of the body, which is the sphenobaselar junction, if all that is in alignment, then you have a less of a problem with this area, provided your muscles are strong, because the muscles will be laying straight and they'll be doing their proper function without having to pull left, right, or whatever, different direction. Oftentimes it's more than just one direction. Lifting and even sitting, because we sit crooked and we reach, we're playing with the mouse and typing and reaching and all that, so we're twisting a little bit. So we have to do those things, but just understand that that does take a little bit of a toll on the body when it's done repetitively. And I'm just really working to soften these muscles through here to take out any tension at all from that area. And doing this side too. Here you can work from both sides if you like, or you can modify. It's a little bit different, a little modification for the hand placements and stuff if you're working from one side, but sometimes you can trot around the table and do it both ways. Just whatever feels good for what you want to do. I'm getting down deeper into the bone. Now here is L5S1, right here. So I'm going to pay some close attention to that, make sure there's spacing in it. So there's some space there. I'm not pushing hard at all. It looks like it. And what I'm doing is I'm spreading this, like trying to get my fingers in between those joints by being invited in. And a lot of this invitation is the very light work and directing energy where it needs to be directed. But you want to be careful when you're directing energy. You don't want to put too much energy in all at once. Sometimes you have to back out a little bit or be a little more neutral. And that's another thing to be trained at. The massage therapy is, as anybody working, is really artistry at its best. And the more acute one has in their hands for understanding what they're feeling, the more artistry they're gaining. I'm just going very slow at it. really paying attention to going along that hip line, but I'm taking the other muscles with it. Okay, here we are here. So now we have, now here I'm just at the L5-S1. This is where I'm going to do a little bit of tractioning and in two directions, just to open it up a little bit more. And that tractioning again is going to be, you don't just go in there and tear them apart. You go in with the subtlety of it, and you move it, and you can feel what's going on. You can tell if there's kind of a twisting or turning in the low back, which you'll feel with the upper hand, and then the tractioning in the low back, that's what you'll feel, or the low hand, that's what you'll feel. You'll feel it separating, not really separating, but giving space to the L5. And as that happens, that opens that up and helps to align everything. Again, this work I do is mostly working with directing energy, where the energy is calling me, where the body is calling me actually for the energy. So you can move things with energy. You don't have to necessarily be hands-on, but I think the best thing is to be lightly on the body and then using the energy, because you can actually feel what's going on. So you know what's happening instead of guessing. Because when you're off the body, you might not, you feel the energy moving, but you won't really know if it's in the right place or anything like that, particularly in this work. There may be other energy work that doesn't matter, but in this work, it's much more helpful to know where you're directing the energy and where that body needs the energy. Because that's, we're energy and frequency primarily, so it's good to begin to think that way. And we're also flesh, and so there's many layers to us. Now along here, and because of what we've done so far, I'm much deeper into the actual muscle itself. It may not look that way, but I am much deeper into that muscle. And it's feeling better and better. Let's glide that thumb along there. And follow kind of the way that the muscle fibers are running. And that is not a cross fiber thing. When you have your hand on the other side, you can oftentimes feel the connection, how the two sides work together in tandem, how connected they are, because it was feeling like, it feels sometimes like, I'll try it here and see if I get the same feeling. It was feeling like there was a lot of movement on the side that was actually stationary, which there is now too. As I'm stretching this, there's movement in the right hand while the left hand is moving. So that tells me a lot of the connection with the fascial structure and the muscular unity. You'll usually feel the different sensations through the body through the unwinding of the fascia. Okay, then you can pick it up a little bit too. And picking that up. And then go out to the outside and make sure that this part is worked. This can just be worked in circles. And Here's where it begins to be a little bit more compromised. Not bad, but just you can tell a difference. That's one thing, you know, that's very important, to train your hands so you can know what you're doing, know what you're feeling. And that's part of the artistry of it. It's a lot more to know than it seems like it is, but it's a very rewarding vocation to have. It does take a lot of work, though, to practice and get there. But what do we have in life? We have time. If you really love something, you'll do it. And if you really love something, it'll start coming to you very mysteriously. Just kind of get it. So yeah, this is feeling good. There was a little bit of compression going on here, and that has opened up wide. Not like big, huge wide, but you know, there is space now, a little more space. And even though sometimes people don't feel pain yet, things could be being set up to have pain eventually as that repetitive motion or repetitive sitting is continued in the same pattern, because the brain is going to pick up that pattern and it's not going to change it unless you're consciously aware of the posture of all that. So that's another thing to think about. Yeah, and I'm going right down a little bit farther onto the sacrum here, and that just feels good. The sacrum is all fused together, so there's not much to do. And then to just make sure the alignment of the sacrum is there. You can do a little bit of traction on the sacrum and just be sure that it feels like it's balanced there as well. And it's pretty well balanced. I'm going to check for a rhythm. That rhythm will tell you even more if it's balanced. I'm just feeling the upper side of the rhythm. But it does feel balanced. So she's pretty balanced in that area. Okay, and then just spread it out. Pull it together. And spread it out. Pull it together and spread it out and pull it together, and that should take care of most, non-chronic back pain mostly from repetitive motion or repetitive sitting, things like that. Just the simple things that we do in life day after day. If there's excruciating pain and all that, it might have gone to the point where there's disc issues. But that doesn't mean that you have to go through radical treatments. You can do a subtle work, and that'll oftentimes remedy it if it's caught, fairly soon, and even some a little bit more severe. So just know that there's a lot of options out there to maintain and to take care of yourself before it does get real bad. And I'm just checking up to the L1, and all that feels good. Okay, so there you have it. This is a little bit of information for you to glean on about low back pain and discomfort. Basically being simple from repetitive motion primarily, and from there you can evaluate if it's something more serious. But loosening up those muscles in that area is really important to do. So I hope that you got a lot out of this video, and please like, share, pass it on, give me a comment. I love seeing the comments, and I appreciate your viewing, and I'll see you on the next video. I want to invite you to explore my course, The Foundations of Subtle Alignment. It is going to take you beyond the work of massage therapy. It will take you into the world of the subtle anatomy. In this course, you will learn about the subtle anatomy and a protocol for assessing and aligning the subtle structures. Misalignment of the subtle structures is often the root cause of chronic pain, injuries, and chronically high levels of stress hormones. These techniques offer profound benefit whether you are working on people with complex issues or not.